All right, good afternoon. Happy to join you again this week to give our second update to the community about what's going on at Children's Hospital. Once again, Matt Schaefer, joined by Dr. Joe Childs, our Chief Medical Officer. Last week, we talked about a number of things. We gave you a situational update. We wanted you to know what was happening within Children's Hospital. Dr. Childs did a great job talking about Delta and the variant and how it's different. We touched a little bit on capacity, which we'll talk a little bit about today as well. We also mentioned if your child's ill, right? If they're COVID positive, what are the best things you can do to help them? And then finally, we finished up with what's the best way to keep you and your family safe? So today we want to focus a little bit more exclusively on what's been happening over the last week or so and some things that we've been working on as a result. So Dr. Childs, just like we did last week, just a quick update for everybody. What's going on at Children's? And I think last week we talked about ambulatory capacity, which may not be a term that people are familiar with. What are we seeing overall happening and throughout our outpatient environments?
Well, on the outpatient side, things are very busy. This goes from the pediatrician or primary care offices to urgent care, and then especially to our emergency room. They're seeing incredibly high volumes, and that just reflects that there's a lot of illness in the community. A good bit of it is from COVID-19. There are other viruses that are also going through the community. They're making kids sick that are leading them to need to seek attention. On the hospital side, things are pretty much the same as our update last week. We this morning had 7 patients in the hospital, 1 in the ICU. We don't have anybody on a ventilator right now, and we usually are seeing 1 to 2 admissions a day, and the patients are here for a few days and then able to go home. But they need help sometimes with breathing or with just fluids or just needing close observation. We have a program that has been ongoing that we think is making a difference in the community, and that is infusing monoclonal antibodies. Monoclonal antibodies are manufactured antibodies that are specific to attack, especially this Delta variant. And they are approved for use in high-risk patients that are 12 and over. High risk would mean that they have either problems fighting infection themselves, or maybe breathing or heart, or significant health issues where COVID presents a particular risk to them. And this product is really designed to prevent progression of the disease. That's what it seems to do, is it keeps you from needing the hospital. In almost all cases, it keeps you from getting worse.
So a couple of things you mentioned there I think are important to make sure that everyone who's listening understands is, last week you heard us say that Children's isn't capacity challenged, right? As the pandemic has gone across our community and across the nation, when we've talked about capacity within the healthcare sector, we've focused a lot on what happens on the inpatient capacity. And the situation isn't any different, as you heard Dr. Childs say today, than it was a week ago or a week prior to that. From an inpatient capacity standpoint, we are certainly busy, but we have capacity. Where we are seeing that volume is in the outpatient setting. And I think that what I would remind everybody who's watching is, if you need care, seek care. Last week you heard Dr. Childs say, start with your pediatrician if possible. If it's after hours and you're concerned, but it's not a medical emergency, urgent care is there for you. And certainly if you are concerned about an emergency scenario, the ER is always there. The good news is, even though the ER is busy and our urgent care environment is busy, the number of children who are needing hospitalization post-ER care is really small. Is that accurate?
Yeah, virtually everybody that's coming to be seen is able to be evaluated and go home.
So Dr. Childs, you talked about capacity, right? And you started to preview monoclonal antibody. We talked a little bit about it last week. Let's just make it as simple as possible. What are the things that families need to remember? So number 1 is not just anybody, which you covered. Number 2 is you have to have a physician order that, right? You can't just show up and say you'd like that. And then number 3, what's our capacity on any given day for antibody infusions?
Well, we are scheduling about 10 a day right now, and as the demand increases, we're going to try to adapt to that. So you have the first several days of illness to get this infusion in. In fact, up to 10 days of illness, it's considered to still be effective. Mm-hmm. So we're scheduling in that time frame and trying to get patients in just as quickly as possible.
So in addition to monoclonal antibody, we've talked about busyness in the ER. And I think you referenced it earlier. We've been able to add some additional coverage in our ER during the day to help with what we would call ill but low acuity, likely to be treated and go home quickly in the ER. What's that coverage look like on any given day, and how have we been able to extend that?
So we've added 5 hours of physician coverage with additional help for that physician, so that especially those patients that could be seen, we think, fairly quickly and evaluated, maybe get a test, and then be able to go home and on with their day.
So the last thing, we've talked about testing. During the height of the pandemic, Children's Hospital operated our testing center for COVID-specific testing. We've reactivated that testing center here on campus. Talk about what that volume has looked like, what families need to be able to come and receive a test here at Children's.
So a lot of families need to know if their child has COVID, and they don't necessarily need to be seen at a clinic or in the emergency room, but they need an answer to that question. And so this is a way to get that test. It requires a provider order that can be done online through our website. They come to our location on our campus. You stay in your car and fill out some additional information on your phone, and then come in briefly to the testing site, get a throat swab, and you're able to be on your way. It's been very busy, but the nice thing is you're able to stay in your vehicle. Just come in for a short time and then check with your provider on the results of that test starting the following day. Tests are coming back in roughly 24 to 36 hour time frame. And in the meantime, you want to be watching your child closely for any signs of worsening that may require that they need a visit. But a lot of children with milder symptoms are questions about exposure that need a test. This is a great solution for that.
So we didn't have the same lengthy update today that we had for you last week, but we wanted to touch on some important things, particularly around capacity and also what we're doing to stay in front of children becoming more severely ill than they might otherwise be. That's what the infusion therapy is about and what the team has been able to do. To keep children who need a test out of the hospital facility. It's essentially why we have reactivated our testing center. And as you heard Dr. Childs talk about, that allows families to stay in their car, to be able to interact remotely only until they need a swab. And then finally, you heard us talk about how we're trying to adapt to the demand that's particularly in our ER and adding additional coverage during the morning hours to try to work through families who are concerned about their child, who need to be seen by a pediatric provider and can do so in a quick fashion. We will continue to keep you updated as we go throughout the pandemic, sharing real-time information that we feel is important to our operation and ultimately important to you as the moms and dads of our community as you make decisions for your children. And consistent with that, tomorrow you'll see here on our social media channels an updated weekly dashboard where we will share the number of children who have been hospitalized over the past week here at Children's Hospital, as well as a snapshot of the currently hospitalized patients here at Children's. Thank you for joining us today. Thank you to Dr. Childs for continuing to lead. Thank you for our team who is doing everything possible to keep our community safe. Please make sure that you're doing everything that you can do to keep your family safe as we go throughout the pandemic. Thank you very much.